Today we have a few very eminent speakers with us to discuss about this subject. And also we have our trustee, Frederick Lean, who will give us an opening remark. And we have also have with us chairman of this Rotary Singapore Institute, Trustee Governor Gimbog, and obviously the RRFC, Jason Lim with us, who will act as a resource person. Today's session, we will talk about the challenges that we are facing right now due to this pandemic situation and how we are handling our grants and how we are doing the best practices with these grants and actually what we are doing right now in this situation for the community. We will discuss on these topics. Before we go, before we introduce the speakers, may I have the privilege to introduce the speakers. The first session will be, the first speaker will be PDG Zainul Abidin from Bangladesh. Second one will be the PDG Anthony Richard from 3272 from Pakistan. And the third speaker will be Saul Hamid, the DRFC from 3310 from Singapore. And the rapporteur will be Leslie Salahuddin from 3300 from Malaysia. So may I now ask past Rotary Trustee Frederick Lane for his opening remarks. Yes.
Thank you, Salim. Moderators of tonight's seminar, EMGA, PD Salim, RI leaders, and regional Rotary leaders, good evening. Tonight, I'm very privileged and honored to be invited to deliver the opening remark for the RRFS under the Zone Institute. We are all facing the strike of pandemic, which is forecasted going to stay with us for quite a long time. All our daily life and business are heavily affected. Our membership is challenged, and so is our foundation. Tonight, we gather here to brainstorm our ideas so that we can help ourselves and our foundation. I saw from the panelists where our longtime friend, PDG Leslie, PDG KM, PDG Richard, they are very best choice from our zones. I'm very sure under leadership of EMGA Salim, you can discuss a feasible way for all of us and also for our foundation. Tomorrow morning, I have a 10-day business trip to Los Angeles. I could not stay with you for the whole session to listen to the great ideas from the panelists. I would be appreciated if my classmate Salim will send the seminar recording for my listening afterwards. I wish you a very successful discussion and a great evening. Thank you and take care.
Thank you, Trustee Frederick, for your opening remarks. It was very inspiring, and obviously we will send you the recording. Hazel is having this thing. So thank you, and I know that you are having a very busy schedule. You are going to LA, you told me, and we are thankful again that you make your presence in this session. Thank you very much, Frederick.
Thank you.
Now we will go to the first speaker of this evening. He is the past district governor from 3281 Bangladesh, Zainul Abidin. He was the governor in the year 2002 and 3, so the seeds of love, and he is now a wizard of Rotary Foundation. He is very known in our all zone, in different zone institute. He is always making a good voice, and he is the special advisor to 43372 in Pakistan for foundation works. And in our district, he make a big difference in the foundation by helping all the governors as well as the clubs. Nowadays, what we have seen that Bangladesh is having so much grants as well as the AKS members and everything. He is behind all of this. So may I request Past State Governor Zainul to speak on this subject, that grants and the post-COVID period challenges that we are facing.
Thank you, Moderator PDG Salim, and to Trustee Frederick. Ladies and gentlemen, good evening. My subject is grants and challenges during the post-COVID period. And my discussion point will be coronavirus pandemic and its global impact as assessed by all the renowned global organizations working on it, its impact on Rotary movement activities, then Rotary's response, and it impacts on the TRF grants and TRF's response. Utilization of Rotary resources, particularly the grants in Bangladesh for COVID impact response, short term and the long term. And of course, I have a suggestion. As the trustee is here, I will take the opportunity to tell about it. Now, yesterday, I had seen one news item in the morning in CNN. A very renowned American journalist, his name is Sanjay Dutt. He normally covers the humanitarian disaster. And he says, COVID-19 pandemic has become a humanitarian disaster in the United States. Now, the point is why I am going to tell you about the United States humanitarian disaster. Because if I go through the definition of the humanitarian disaster, UN says a humanitarian disaster of the function of a community or society involving widespread human, material, economic, and environmental losses. And moreover, the impact which exceeds the ability of the different affected community and the society to cope with its own resources. That is the point of discussion I want to make. Then why Dr. Sanjay said this? He said this because he says in his 20 years of service as a journalist, he considered this is the most devastating humanitarian disaster because he has seen Haiti earthquake where 220,000 people were killed. He saw the tsunami where 228,000 people were killed. And he also saw the Somali famine where 260,000 people were killed. But this one in America, in one country, they have affected persons of more than 10 million, and the casualty is 240,000. My dear friend, now this is the reason to understand what is the gravity of the situation. If we see the statement by the different organizations of the world who are working very closely with this pandemic situation, if we see the comments of United Nations, World Bank, ILO, WHO, they say coronavirus is killing people, spreading human suffering, and upending people's lives. But it is not only a health crisis. It's a human crisis, it's an economic crisis, it's a social crisis. The effect of it, if you see that, it will be very, what I will say, will be shaken. That is, the global GDP in 2020 will reduce to 3.2 to 5.2. Potentially the largest contraction in the last 20 years. And since depression, it is one of the greatest, then it is also worse than 2008 and 9 global financial crisis. In 2020, millions, maybe the estimate, the figure says 35 million to 60 million people could be pushed to extreme poverty. And 1.6 billion people working in the informal sector, including the gig economy, in where our contribution is, Bangladesh contribution is very high, are estimated at the risk of losing their livelihood and may lack access to any form of social protection. They also say, out of the 17 goals of Sustainable Development Goal, 12 will be directly impacted by this. So this is, gentlemen, is the scenario. Now, this is not the end. This is what they can visualize, but there are many other terms what they cannot imagine right now because there are a lot of uncertainties are there. These are like, what will be the economy? Because they do not know how long it will prolong. Whether there will be second is on, whether the third will be there, nobody knows. When it started, we never thought that after 8 months it will be there. So we do not know. So how much effect it will have on the economy of every country, it's not yet known very definitely. Then the society, there will be behavioral change. Why? Because of the social distancing, our relation, person-to-person relations are very isolated. Whether that will continue, because human being wants the in-person relation in a better way, particularly in the family, whether that will have impact on the social life as well as on the economic life. Then in politics, of course, you have seen in politics, with COVID, so many politics are going on globally. So I must not mention about that. The technology, now everybody is competing who can come up with the vaccine fast and who will control it, who will get the major share of the market and all these things. So these are uncertain. Then sustainability. We give the maximum focus to the environment, climate change, whether that will be continued or, as the people are saying, they will ignore it for their own interest. My dear friend, this is the global scenario. Now, how it affects the Rotary? Now, it affects the Rotary because of the fact our cherished goal is our vision. In our vision, what we say? Create a lasting change for a better world for all of us. And how we promise to do that? By rendering service. And how we implement that? It is by the TRF mission. As it says, mission of the Rotary Foundation of Rotary International is to enable Rotarians to world understanding, goodwill, and peace through improvement of health and support of education and alleviation of poverty. And all these three things will be severely impacted by the COVID. My dear friend, so this is now how it will affect the Rotary movement, our activities. The Rotary leaders have found out, that this will have impact on what? Grants, polio, then Rotary International Convention, as we have missed one, then other major Rotary events like today one, then the club and the district meetings, Rotary leadership and committee and secretariat all will not function properly as usual. So there will be some problems. Maybe Rotary Youth Exchange is halt. Then Peace Fellowship is also not working, and the Rotary funded trouble to implement the project and monitor it and doing the audit. All these are not being done properly right now because of the COVID. Now, my dear friend, what Rotary has done, they have done, in the meantime, a lot of things. What is that? In the last year, district grants, they have included COVID portion to have include the district grants, all the activities of the COVID, like purchasing of the thermometers, protective medical gear, and items donated to the medical professionals. Then create awareness for the social distancing, distribution of the mask and the hand sanitizer among the poor disadvantaged people. And in our place, we have also done what we distributed the food packet to the poor people, the floating population of the urban areas, because they do not have the facility in this period because of their lockdown. They cannot go out, they cannot cook their food. So we prepared and distributed the food also. Then the global grants, the beauty of the global grant is, as you all know, the last 6-7 years, whenever I attended any seminar or any meeting in this region, I always mention about one thing. The greatest challenge of the global grant was the participation of the international partner with 30% funding, international partner 30% contribution. That was really a challenge. But as soon as the Rotary Foundation thought that by relaxing that one, it will be easier for participation in the global grant, all of a sudden, so many grants are came that the World Fund is exhausted. So that is the reason that in doing so, Rotary Foundation has created an opportunity to participate in the grants to support the COVID. And in our country, we have taken the advantage of this one. Because of this, we could motivate about 5 generous contributors to become AKs, and all of them are coming up with the big amount of money to support the project related to the COVID. My dear friend, I want to make a comment at this point. As this restriction was relaxed, it was good for participation in the COVID. Now it is 15%. It is okay, but there is the restriction of what? Restriction of no match for the cash contribution. That is a real challenge. My dear friend, our trustee is present here. Through him, I will try to convey our message that unless this match is there, we cannot encourage the participant or the donors to contribute fund for taking up the projects to mitigate the sufferings of the COVID. Because COVID has a long-lasting, devastating effects. It requires patronization from the very beginning. So that point, I will clarify another point with that one later on. Okay, then Rotary Foundation did another things. At the beginning of this, they awarded $20 million support to the Rotary clubs for taking immediately the COVID. And COVID-19 disaster grants they did in last year, and there were 319 grants, and with the expenditure of $7.871 million. And in 1920, total their global grants were 1,359 with 42.591 million, and total funding was one fund was 42 million, and total funding was 105 million point. So you can see in that also there are a lot of projects like us, because in Bangladesh we have 11 projects last year to work with this global grant, and these are focused on Rotary Foundation's global grant focusing on the
COVID
pandemic. Okay, now it comes what we in Rotary in Bangladesh we did. In Rotary Bangladesh, what we did in the initial stages, we followed this prescription of the World Bank. They said that please go ahead following this immediately so that you can get relief to your people. This is what provide immediate support to that detect, contact traces, treat COVID cases, upgrade health facilities and laboratories, and provide screening and
Something wrong? Hazel?
No, I
Something
think
wrong?
it's his internet.
Can you hear me?
Yeah, he's here.
Okay.
Yeah, we can hear you.
Can you hear
Carry
me?
on. Yeah, carry on. Carry on, we can
Okay.
hear you.
Okay. Then, yes, then in Bangladesh, in future, what we are going to face, that is in our domestic economy, we are going to have a big blow. Why? Because in the meantime, you know, we are the second biggest, largest garment exporter of the world. And in the meantime, the foreign order has decreased by an amount of 3.1 billion. And it is, you know, 11.3% of our total GDP. And if it is done like this, then about 2.28 million workers will be without job. And it will also affect what? The remittance of the Bangladeshi workers working outside, because that is also a big contributor to our GDP. And on GDP contribution of this is 9%. Sorry, is 12%. And it employs the 9% of the employment of our total active people working. So, my dear friend, it will destroy or affect on our domestic economy. It will have reduce dangerous effect on our other income. Then in education sector, we have 36 million students are out of the school for the institution for the last 8 months. And out of that, 17 million are the primary schools located in the primary rural areas. We are having the distance learning, but unfortunately, this is not available to the rural schools. So Rotary can help there by providing the smartphone and the net connection. And the health sector, Bangladesh government said to meet the immediate demand, it requires 250 millions to support the existing installation of healthcare so that they can come. Yes, I know, I have, yeah. So this is the impact in Rotaries and in Bangladesh. And for doing that, as I said, we have done 8 projects on the COVID for the global grant last year at the cost of 439,000. And in our district, the other district has 3, that is 77,000. The total is $516,000. So that is the our involvement in, of course, COVID programs. But we shall have to take other measures so that we can do it. My dear friend, I tell you one thing. The last year, the Global Fund was for 1,359 global grants approved last year. The World Fund was 42,000 or the 43,000 maybe. Sorry, 42 millions. Then with the total of 105 million. So out of 105 million, the World Fund was only 43 million. So I suggest here that there is an endowment fund. If annual expenditure there is only 43 million, so why not Rotary Foundation take a loan from the endowment fund for next 5 years and support the global grant by matching it with the cash contribution. Ladies and gentlemen, that I wanted to say. Thank you very much for listening to it. Thank you.
Thank you, Pastor Governor K.M. Zainul Abidin, for your very elaborate deliberation. In the meantime, we like to welcome two VIP in our midst. One is the chairman of this institute, Rotary International Director, City Sergeant Yu, He is with us already. And also the trustee, Aziz Memon, is with us also. Let us welcome both of them. Thank you very much for joining to both of you. Now, may I invite the second speaker who will speak on the best practices of these grants during this pandemic situation. He is none but other than he's from 327 from Pakistan, PDG Anthony Richard. He has been the DRFC. He is now working with the stewardship and also all this foundation programs in that district. That district is having a big problem with last 6-7 years, but with the help of these people, they came out of that problems and now they are on the track to go with the situations. And I hope that he can describe how they became they overcome that situation and now how they are doing in Pakistan and as well as the world, our zonal cinema. Let us welcome Anthony Richard from 327 to Pakistan.
Thank you, Slim, and good evening to all the participants. It's great to be here at this Rotary Regional Foundation seminar and talking on the subject of grants. A great presentation by PDG Zainul. I appreciate all the things that he said in his presentation. So I will move forward and share my presentation screen with you. And Hazel has already helped me with it. So I think the test run was okay. So are we good to go? And
Yes, go
can
ahead. Go ahead.
Can you hear me and see me?
Here we
Both?
can hear you, see you.
Great. Okay, so the subject we are talking today about, and you can see I've put there best practices on grants post-COVID, and there's a question mark there. And the reason for the question mark is that I really don't feel that where the world is at this point, we can think in terms of post-COVID, but definitely a day will come with the prayers of all that we may be standing in a post-COVID world. But at the moment, at least in Pakistan, the numbers are rising. We are trying to keep them low by observing the guidelines. And as we can see that in other parts of the world, the situation in many parts is the same. And the second wave, that is the so-called second wave, is upon us. So best wishes to everyone. And so here's a saying that about best practices. He said, it's something that you've probably seen before. It says good, better, best. Never let it rest till your good is better and your better best. So best practices actually is learning. Best practices are experience. Best practices, you keep improving on what you've been doing and you learn from success of others who have had success. You learn from your own failures and you keep adding to the list. So best practices is something that is in every area. And in Rotary, we find that Rotary has actually done absolutely great job of documentation and best practices and guidelines for Rotarians to follow in almost in every area. But then something like the pandemic comes along and the best practices are not best anymore. They're still there in principle, but changes need to be made. There's some fine tuning that needs to be done. There's different ways to go forward, but the best practices remain the same. So the methodology I've used is building on what Rotary already has in terms of best practices. And during the virtual conference, we had Abby speak on these, which was really great and was a great presentation. And now we are in what is the COVID time, where those best practices just need to be looked at and how we can move forward and go forward on them. So of course, why best practices? Best practices ensure success. If we want to move from 80% to 100%, we need to have some guidelines, we need to have checklists, and those, what better than the collaboration from Rotarians all over the world who have done so much and are learning from them to produce these kind of checklists that will help us go forward. It is like saying we don't want to reinvent the wheel. There are a lot of people who are working on that wheel, and since our symbol for a long time was the rotary wheel, probably applies more to us than others. So we can work forward using what others have done. Best practices, of course, ensures success in the application, success in project implementation, success in reporting, monitoring. And then another thing they will do is they will create new best practices, which if we document it and do it well, we get a new set of ways and things to do. Now, I won't go this grant because this has been covered very eloquently by PDG Zainul regarding the changes in the, you can say that came in after July regarding the grant funding, and he has covered this in quite good detail, and also has made a great suggestion that maybe this the cash contribution should be matched by other means. So I leave it him to fight the case for all of Rotary in that area. COVID-19. The saying is that our world will never be the same. We need to reimagine how we did things. We will come out of it. We will be a day in the future when we will be COVID free. There will be a day in the future when the vaccine will have been developed. There will be a day in the future when everybody's prayers are answered. But this has given us an opportunity to reimagine how we do things. And we have seen that in Rotary. We have seen our first ever virtual convention take place, and we have seen the coming together of the Rotary community over video conferencing, collaboration, online tools, and a greater use and a greater networking than was possible before. So if there is, normally you cannot say the pandemic has a silver lining, but if there is a silver lining, it will be the increased collaboration, the increased use of online tools that has made it possible. But there is still those in need. There are still those who look to Rotary and who look to Rotarians for support. And their needs have increased because there are additional challenges, economic challenges that COVID-19 has. So for us to move forward with those best practices, aligning them so that they meet the COVID needs, they allow us to stay safe, but also allow us to move forward and address the needs of the community. Also, the ongoing grants, how we can make sure that they stay safe also. Of course, there's a big question. PD Zainul also touched on it. We are the people who have been the vaccine people of the world, you can say, distributing the polio vaccine all over the world. And there is a concern when this vaccine comes out, will it get to the marginalized countries? Will it get to those in need? Will it get to people who may not have easy access to it? And there we can think that will Rotary International be able to play a role in this? Can Rotary leverage our global presence and standing to be a part of fair selection for countries and peoples of the world for vaccine distribution? We have our trustee Aziz Mehman here, our national polio chair, and we have a polio vaccine success to speak. So this is just, you can say wishful thinking, but there is concern among people that should this vaccine come out, how does it get to the countries that are, you can say, more on the marginalized side than those that possibly can afford it in large numbers. So the first best practice of the global grants is something that changed. The grant management seminar was essential to doing a global grant. You got awareness, you got to know how to do it, you learned how to put your application, you learned how to do the assessment. But that is one thing that changed, and many of us have probably attended it. Some were lucky, that at the onset of COVID, they managed to attend an in-person one. But this was a seminar that was in-person, face-to-face event. It is a mandatory attendance by 2 members of a Rotary Club. It normally was a large venue to accommodate participation. And the recommended format was to have a workshop roundtable conference. And we also noticed in our part of the world that people did not take the grant management seminar seriously. Many afterwards were still asking questions. The global grant application was not understood sufficiently, and in spite of being face to face. So definitely this is one area where the best practice has changed and moved to an online grant management seminar, where everyone has a VIP seat, where every table is the best table. The presentations are clearly visible. In the large room, if you are sitting at the back table, you were hard pressed to see what was on the screen, so you started talking to each other and you missed the bulk of what was important in a seminar. The presentations are clearly heard. And I work at a university, and we have now all over the world also what is called a hybrid model, in which you can have online and in person. So the grant management seminar of the future, even after COVID, will probably remain in some form in online, because the takeaway from an online grant seminar essential to doing a global grant is definitely has more value in being online. The hybrid model will allow clubs to attend this in their small teams from individual places and be a part of a larger group to ensure a workshop format. We have seen Rotary use Zoom very effectively with breakout rooms and also match the, you can say, face-to-face experience. Additionally, we have also seen that the Rotary Learning Center has the complete GMS available as a course. The next step would be to build a team. And for that, I mean, we are all great leaders here. So I just have a few points that, you must know what a team is, the purpose of the team, establish connection between the members. And this is something we were doing as a best practice. We were doing it face to face. We were doing it in meetings. And that's how we proceeded with our initial steps of grant management. This is another area where what we can say in COVID or post-COVID, there are advantages in moving to an online format. Project teams can work effectively online, maybe even better. The responsibility of planning for all stakeholders to stay safe is something additional for the team. They have to ensure that when they meet, when they plan to meet with community, when they plan to meet with stakeholders, when they plan to meet with for advocacy, that they are following safety procedures. This is an addition to what they were doing previously. So this is an added, you can say, agenda item for them. Otherwise, their working as a best practice will not see much difference. Probably they will be much more effective in an online world using online tools. Regarding team building, I'm always reminded of this book, and I'm sure many of you have read it. And this is a book by Jim Collins, Good to Great. And in selecting a team, it says, get the right people on the bus. Also, you have to get them in the right seats on the bus. So when you build a team for a global grant, you have to get the members who are passionate about what they do. You know what their strengths are, and you put them in the team so that they are able to take that grant forward. They're able to take the community forward. They're able to take the beneficiaries later forward. One of the things that is mentioned now is that to request a preliminary review. This was already done over cyberspace. I mean, most of our correspondence, at least in Pakistan, is over over email, and you don't see any difference in a COVID or post-COVID area. You're still going to very rarely meet, and you're going to be mostly collaborating online. The difference is that nowadays, if you send a mail, you will probably receive a message saying that there are possible delays in receiving response due to, and there will be an automatic reply. So that is probably the only change in this area. And invariably these days, when I send a message, this thing pops up, and then you will be waiting, because the workload for the regional grant officers, the workload for the foundation team has increased substantially, because in a work from home and in a work from office environment, the load factor has increased tremendously. But otherwise, this best practice that Rotary has suggested should produce eligibility of grants earlier. It is said that if you reach out to the grant team early, you will not come to a stage in the grant planning process where you have crossed certain landmarks and now have to go and redo it. So the preliminary review at a point when you are somewhere halfway through or maybe earlier will let you know that you are going in the right direction. The community assessment area is absolutely essential. This is what PDG Zainul always impresses on me, that this is something you can't do without. You need it. Absolutely. You need to do the legwork. You need to reach out. You can't make a grant in your drawing room. You need to go and see what is actually required. And COVID has made some differences here. I work at a university, FC College University in Lahore, and we are doing a couple of projects, and a lot of planning had to be done in how to meet up with the community in a safe way. How, so that the people you are trying to serve, you do not affect them in any way. That you not bring more challenges into their life at this time when staying safe is important. They definitely need all the help they can get, but they also need for those who know to make an effort so that it's possible to go forward. And what we did was we took all the necessary technology with us, and this is also been mentioned by PDG Zainul, to make sure that we were able to do that interaction in safety through technology, where one or two of our members met with the community, took the necessary Wi-Fi device along, took the necessary webcam along, and then was able to meet with the rest of the group, which was sitting at home. So an important part, you cannot go ahead as a best practice, but needs to be differently till such time that we are actually in a post-COVID area. We are in a time when we do not need to take safety precautions. We are at a time when we do not need to stay safe. And it's important for us to not put a further burden on those we want to help or those we are aiming to help by putting them in a stress. And so taking measures and thinking of methodologies to do this, that is important. So I have said here the team members visiting community should be equipped with appropriate technology. And then this is an opportunity to also teach them, because if this carries on, which is we can see it's carrying on for a while, to share those skills with those that don't have it is also an opportunity at this time to teach people the tools to connect, to teach people how to use these tools. So while you're doing an assessment, you can also pass on the learning and the technology, which will come in handy when you go ahead and you get a grant approved and you go towards implementation. You will have a more savvy, a more learned community. Hopefully, like I said, that there will be a time that we will be out of this COVID, and these practices will actually still serve us very well at that time. The resources were always available online. So in the best practices, there is no change. They were available online. We know that Rotary has done a fantastic job in in changing up our My Rotary over. There was a small time that it was out of, you can say, out of access, but now it has come back stronger, faster, with more information, with better information, and in a way prepares us to move to this online world. But we are a people uh, community all over the world. They say we are social animals. We need to meet also. You can't do everything online all the time. But a lot of things are already made available in the best practices by Rotary, putting additional information on the My Rotary website. We just have to make sure that we are using it often, we are using it frequently, and we are keeping ourselves updated as and when the changes are coming on. The areas of focus also doesn't need a change, but like PD Zenul said, COVID has its own challenges. We have got a new area environment that has been added, which will become a part of grants in the future. The recommendation here in this presentation that I'm talking about that was given at the virtual conference was that if at all it is possible, just try to make it in one area and not more than that.
Anthony, you have 2 minutes.
Right. A detailed plan now should also include COVID-19 related challenges that are possible. Rotarian involvement, collaboration and communication has improved substantially with video conferencing. Before you had the international Rotarians not that much involved. Now they are as involved. So like I said, if there's any benefit that has come, it is the increased closeness that COVID has brought about and the enhanced use of technology. In vendor selection, vendor interaction, delivery of goods, these are areas that need special significance. We have a global grant in Pakistan, Gift of Life. It had to be stopped because the cooperating organization had to put COVID safety rules in place, had to make sure that beneficiaries were COVID negative before they came in for the heart surgery, had to make sure that the hospital was COVID free. So for ongoing grants also, it is important that the grant continues keeping beneficiaries safe. Finally, of course, the local community should be able to take this over. And in post-COVID, there's a challenge because communities are hard pressed how they will be able to do it. But there's an area that we can definitely work with them. Cooperating organization need to add COVID-19 to their services provision. Like, as I mentioned, we have an organization already, and this needs to be part of the cooperating organization that they will carry out their services in a COVID-19 safe area and following safety guidelines. Last but not least is provide answers to everything. Do not put NA or not applicable. And this was something that was strongly suggested at this virtual conference, which I enjoyed tremendously. Thank you. Stay safe. Prayers for all. And should you have any questions, my email address is at the bottom. It's great being here with you today.
Thank you very much, Pastor Governor Anthony Richard. You have given us a very good direction and how the things are working on now. This COVID situation have changed our whole life by making us a digital one. I hope that people have some question and we have a session for a question and answer. Please keep it on that and we'll take it up after the deliberations of the speakers. Now we will come with the last speaker we have today. It's none but other than PP Sahul Hamid from 3310. He is the current DRFC for that district, and he is known as a expert of global grants. He have gone to India, he have gone to Nigeria, he have gone to every part of the world from Singapore, you know. So his networking is now the fantastic. So we like to know from him what is the success, how we bring the success in these global grants in District 3310, as well as this part of the world, and what is the takeaway messages from these global grants that we can take. PDC Governor Sahul, welcome.
Thank you very much, PDG Salim. It's indeed an honor to be able to share the Zoom stage, so as to speak, with two very eminent speakers. As the last speaker, it's always very challenging to speak after two really good speakers. So if you hear things that that you've already heard from the first two speakers, then you know it's really, really important. All right, so let's get going. Just a recap. The Rotary Foundation is a charitable arm of Rotary International. We have a charity status under the Rotary Foundation. It's something that we must really respect and then we must really continue to do as best as we can. The first speaker already spoken to you about the mission and the vision. So to recap again, the mission of TRF, doing good in the world and making the world a better place. I think there's nothing that we can argue with this. But who are we? Before we go further, trying to think about what to do for the world, trying to do what kind of global grants that we can do, what kind of projects that we can do, what kind of beneficiaries are we looking at, who are we? I think it's really important to hold back, look back, and see what we are supposed to do and what is expected of us, right? So together we see a world where people unite, people like you and me, take action, and we make changes that are lasting, not only within our communities, but across the globe and in ourselves. COVID-19, the pandemic, I think much has been said about it. I'll not say anymore. But I think I just want all of you to just sit back and relax. We'll take you on a journey to visit some of the projects that COVID-19 has made an impact on. Let's go to Lagos, Nigeria. You see these children, very happy faces, despite the fact that they are queuing up to have HPV vaccination done under a Rotary project. So what's happening now in Lagos? The schools are closed. This project is being held up. 500 less children are being vaccinated. The same thing is happening with another grant that has been approved but cannot be implemented in Nigeria. Not only in Nigeria, fellow Rotarians, similar projects in other parts of the world, including in India, are similarly affected. Another project in Nigeria. Look at this young child in a country like Nigeria where unemployment is really high. What is the future for him? Our limb project provides free limbs for beneficiaries like him. There's one thing that we all must keep in mind. He needs a change of limbs almost every year because he's a growing child. The limb center has been closed, fellow Rotarians. How is it affecting him? He needs a new limb badly. So these projects are also being held up. Let's go to India. The Rotary Club in Singapore, together with District 3490 in Taiwan, put together a really big 2 global grants 2 years ago for a school in a village a few hours away from Calcutta. So these are the happy children with their new school, taking a picture here. But more importantly, the project together with this global grant project, there's also a budget to feed these 150 children. In this pandemic, the school is closed. These meals that the children are having, even though it look really simple to us, is the only square meal they get in a day. So we are not able to feed the children, fellow Rotarians. What else does the pandemic do? Toilet construction in India are being held back. So children like this little girl, she's still waiting to have a toilet in a school. What about in Indonesia? What about disabled children who need help with physiotherapy? What about disabled children who need help with speech therapy? These are real global grant projects that are really being held up because of the pandemic. In Vietnam, clean water project has been held up twice, not only because of the pandemic, but because of the typhoons that's hitting central Vietnam right now. And this project is in central Vietnam itself. In India, surgeries like you heard from just now, some of these eye surgeries are being held back, and surgeries like this are considered as non-essential because they are not life-threatening. And this poor child doesn't know when she's going to have the other eye operated on. As I speak, just yesterday I received news that this Gift of Life project in Calcutta for children outside India, namely in Afghanistan, has to be postponed because the children cannot fly in from Kabul for various reasons. So projects like this are being held back. This is the collateral cost of the pandemic on our global grants. How about in Singapore? Our project Football Plus bring together at youth risk to teach them life values and to stay away from unsavory elements and peer pressure and how to say no to drugs. Football is banned currently in Singapore. Gathering of more than 5 persons are banned currently in Singapore. Another project, Architects of Life, they help to equip and empower youth at risk in the prison, are also affected because there's no go for anybody to visit any institution at the moment. What about mental health? Projects like mental health wellness are being held back as well. And it's adding to the fact that COVID, the pandemic, also has deleterious effects on mental health. The number one cause of death in Singapore for young people between 15 to 25. I'll say that again, fellow Rotarians. The number one cause of death of young people between 15 to 25 in Singapore is suicide. 200 suicides a year, right? So global grant projects are being held back because no access is being given to the schools. So what can we do? We have to think of something. We have to rethink. We have to redesign and we have to relaunch. This is not official TRF, I must say. This is mine, all right? Something that I've been thinking about really hard and I was glad to be given the opportunity to speak. This project, for example, a newspaper article, right in the height of the pandemic, when I read it, tears came to my eyes. We have friends in Madhya Pradesh. I know the DRFC in Madhya Pradesh. We came together in a phone call conference and we decided to put together a COVID-19 project. One of the speediest approval ever. 4 weeks from application to delivering of the items at the site itself. For this, I must really congratulate TRF for responding so well, as you heard from the first speaker, when this pandemic came along. It's not always this case, fellow Rotarians. You know that. When Global Grant starting in 2013, we had Typhoon Haiyan in Philippines. We had the Nepal earthquake. And those of you who were involved at that time, you must remember that you were really upset when we couldn't do simple housing, we couldn't do water filter projects for the affected communities. But thank you, TRF. I think it was a great job. Not only that, we came together and we did really well. We had great opportunity to learn and do and service as well, despite the pandemic. And there were changes, as the first speaker spoke about. We were up to 50% of equipment, which are namely equipment that can be used and has to be thrown away, like your PPE kits and N95 masks, were kindly classified as equipment by TRF so that it can be used and can be purchased with the grant money. Food rations. Food rations was also included under the global grant approval. And that was really, really great. Even in Singapore, we managed to do a big grant for about $130,000 with partners all over the world to provide PPE to our Ministry of Health at the height of the pandemic. So this is a picture of the face shield. We donated altogether 18,000 face shields to the Ministry of Health to be used in all COVID-19 centers in Singapore. And we also put together a grant, the same grant that paid for 30,000 reusable masks to be given to those who are less fortunate in Singapore. So what do we have to? We have to really rethink the way we approach doing global grants. We have to recalibrate, and recalibrate. Let me give you an example. So this project, we had close to $250,000 approved for this project. And the purpose of the project is to do the school, as you've seen. But what happened now? As part of the budget for the project, it allows us to build a playground. But the children are not coming to school now. So we have to think, what can we do with the extra money? We have to think of an idea. We have to reassess the situation. We have to talk to the community leaders. We have to talk to the school board. We have to talk to the teachers to see how we can best use the remaining funds. I think it's pointless to just wait and sit on it and do nothing. The same thing, this program also pays for the training of teachers. But with COVID-19, the training has gone online. This is a tremendous savings. And the project leaders are coming together to think how we can make use of all this excess money so that we can better reach the beneficiaries itself. So rethink, redesign, and relaunch. When we do that, fellow Rotarians, I think we must fall back on a really, really important document. All of us forget about this document called the Area of Focus Policy Statements. When you do and plan based on what you think is right, the problem will occur and you will get very disappointed that your project is not approved. So please, this document is easily available. It tells you specifically what cannot be done. What cannot be done. And it also tells you what can be done. So great document as a reference, right? So for the same project, the project leaders are thinking of what to do, how to reach out to the students, how to be able to provide them with an education despite these difficult times. I'll give you another example. The Help the Children project was a project between the Rotary Club in Singapore with the Rotary Club of Malang Central in Indonesia in District 3420. It's a great project. It's been going on for 10 years. Out of 10 years, we had 3 cycles of global grants. We were able to move, we were able to expand our reach from helping just 100, 200 students all the way to 1,250 students. But this year, fellow Rotarians, the project was halted because there was no access. Can you imagine being a 10, 12-year-old child in rural Indonesia, looking into the future in normal circumstances pre-COVID time? The future is already bleak. It's already bleak. They have to grapple with a lot of problems with access to education, the teaching standards, malnutrition, and the pressure from the family for 12-year-old boys to go out to work. What if you're a girl? What are the odds of you getting a proper education in peacetime? What is it now during COVID-19? So you must think of a ways of how we can rechannel the funds that we have for the children who are not being able to come to school. I'm not going to go through with you in details what we can do and what we cannot do, but I just want you to rethink how you can redesign so that you can relaunch the project so the beneficiaries will continue to benefit. Our teacher training program was affected. In 2020 itself, in July, we had this teacher training project approved on the 3rd of July, as you can see. But the program cannot continue because there's no physical training allowed. So the project leaders are thinking of how we can reach out to the teachers, how we can still continue to improve the capability of our teachers in this area so that they can continue to teach, so they can continue to maintain that standards so that the beneficiaries, which are the students, will continue to enjoy the fruits of the labor. Rethink, redesign, and relaunch. Another example, this is a project that we had in central Vietnam. It's an economic livelihood project approved by the global grant. It's a very simple project. 150 families get 100 7-day-old chicks so that they can raise and they can sell back to the market so that the excess money that they get from that will become an income for them to repurchase new chicks and so that the process can continue. So what happened with the pandemic? What happened with the pandemic? Markets are closed. People are not going out, right? So the Rotary leaders there have to rethink of how to ensure that the beneficiaries at least have sufficient money, have sufficient income so that they can survive. All right, so the project leaders came together and reorganized the way the chickens are being sold in the market. They reorganized the number of chicks that each family is going to get so that they can slow down the process and be able to manage the expectation of the beneficiaries itself. Right? So rethink, redesign, relaunch. Nothing will change. The sustainability factor of your grant and your new grant will remain the same. You still need a vulnerable population. You still need training elements, whether it's online or offline. You still need to make it, you still need to aim where there's some lifelong skills involved, and you have to make it sustainable. These things, fellow Rotarians, will not change. You have to continue to think about these factors. So right now, the takeaway message is that we as Rotarians have made this promise to do good in this world. So I ask all of you to join me to invest in humanity. Why do I say that? This young boy, I first met him in an orphanage. Somebody told me that he was 5.5, 6 years old. I couldn't believe it because he looks half his age. But something more interesting, fellow Rotarians, is that when I tried to speak to him, when I tried to entertain him, there was no reaction at all. Until somebody whispered to me, Dr. Shahul, he's hearing impaired. For a child like this, life has to continue. COVID-19 will not make very much of a difference to him. So we as Rotarians have a duty to continue to support beneficiaries like this so that their world as they know it will continue as best as possible. Project Fellow Rotarians are unending. Community service is something that you cannot say, I'm done for the year, I'm done for the decade. There will be more and more projects. So we look forward to your continue to rethink, redesign, and relaunch the Global Grant Project. Thank you very much for listening.
Thank you, past president. So successful in networking with all these countries. Thank you for your good guidelines. Friends, now it is the time for question and answer before we go to the comments from our VIP. Question and answer for 10 minutes. Anybody have any particular question for the three speakers that they have spoken? You can use the chat box also for the question.
I have a question.
Yes, go ahead.
Yeah, this is PD Shahzad Ahmed from District 3272, Pakistan.
Yes, welcome.
And I must congratulate all the speakers for wonderful presentations. Bangladesh has a very successful track record of attracting AKS members. So can any of you friends from Bangladesh share how you did it?
This is Zainul.
Yeah. Can I?
Yes, go ahead.
If we speak about this year, that means the last year, when the pandemic was there, the whole world was shaken. At that time, we had a great demand for improving a number of the hospitals. They lacked the facilities for giving the right service for the COVID patients, say for the screening, say for the treatment, and particularly the respiratory system, the oxygen supplying equipment and all these things. And another thing is screening. So there are always good donors in our community. So there are a lot of people, those who are willing to support these hospitals. We went to them. When they expressed their desire, we told them that you pay as a Rotarian, you contribute to the Rotary Foundation, say 50,000. With our support from the foundation, we can make it about 100,000. That encouraged them to put the money as a contribution to the Rotary Foundation. And they also commit that they will continue to pay and support like this in next 4 years. And thereby they made a pledge to contribute 250,000. The first year's payment of 50,000 they have paid, and they become AKS. So in this way, in the pandemic situation, when the whole world was shaken, we were able to convince people and get 5 AKs last year.
Let me add with this thing for your information. That is not the end of the story. This year also, the same thing is happening, though the there is a lot of changes between last year and this year. So this year also we have already 2 AKS placed for us, and there are in the pipeline there is 3-4 more also to help us with this to overcome this pandemic situation and come up with this health issues in the community. Any more question?
Yeah, here is PDG Professor Dr. Toyob, RRFS 3282.
Yep.
Are you hearing me, Salim?
Yes.
Okay.
Go ahead.
I had an observation actually to all panelists and even though you. So how do Rotary Foundation respond to any disaster or any pandemic? We had many good work. We had very good response in any sort of disaster and pandemic. But do you think all the panelists or anyone can answer that our public image, how do we respond in the pandemic or disaster? Rotary come forward, foundation come forward, Rotary clubs work together, come forward. But our public image is significantly in that ratio is increasing or not. If it is not, what we can do to increase our public image? As if how do Rotary is working in different pandemic or disaster, but uh, what is my observation, our public image is not increasing in that way actually.
Okay,
That's why sometimes we are
somebody
not,
else.
yeah.
Okay. Anybody wants to give the answer to this question?
You
If
want me
not,
to do that, Salim?
yeah, go ahead. Go ahead.
Well, as a matter of fact, I would be answering this question in my closing remarks, so I believe it that way.
Thank you, Trustee Aziz. Thank you. Go ahead.
You want me to speak now?
Yeah, go ahead.
Yeah.
Okay. Thank you, Salim. And what I heard was a very interesting discussion and some very good suggestions made by the speakers about the Rotary Foundation. Rotary Foundation went into action immediately as soon as COVID struck. And within a time of 24 to 36 hours, almost 355 grants of $25,000 were approved for all those districts who requested for it. Other than the $25,000 grants, we gave 369 COVID grants. And these grants also had something different because the conditionality of an international partner was waived. So, and then the total infrastructure available in the endemic countries for polio went into action for COVID-19 and helped us to flatten the curve to a great extent. So my friends, Rotary Foundation is your foundation. Now we have been talking about encouraging global grants. But on the other hand, let me share with you that we have oversold global grants. If you look at the numbers of global grants which have been received till today this year and compare it to the last calendar year, we have a demand of 300% more. Now, this is definitely going to dent on the World Fund. One of the speakers said that cash contributions are not matched. They cannot be matched because, see, you have a pie. Now, you have to distribute that to the DDF, to polio, to the scholarships. There cannot, when the trustees had to take the decision of doing away with the cash contribution, I can tell you this was the most difficult decision, but we did it. And at that time, our trustee chair was Gary. He also was not happy. But the figures, one of the speakers said that take loan from endowment. How can you? Because the whole problem started when the income, the returns of endowment went down. We have a limited cash available. Every month, trustees are reviewing the World Fund figures. In the meeting coming up in the next week also, this is on the top of the agenda, that we need to make sure that how we'll be able to help take care of the global grants. And one of the speakers had made a list of global grants facing problems. Now, this is not just because of the pandemic. Normally also, there have been times when the global grants have gone through problems, and there cannot be a rule across the board. No, it cannot be. Each global grant is a different grant, and the global grant, the host club, the international partner can always write to the Rotary Foundation Grant Management Committee and ask them that this is the issue, how can this be remodeled, how can it be, and they will be able to respond to it. So this was another point, and I mentioned to you about the there was one question, about AKS members. Yes, I'm very happy that Bangladesh has done very well. Pakistan is also doing very well.
Well,
We have in one district one AKS member chairman circle, one trustee circle, and last week we got another one. So this will be making it 3, and we have got 2 in pipeline. I have few commitments from District 3272 also. So let the success model of Pakistan breed AKS members within ourselves. Bangladesh, we are proud that they have come to 16, and let them go to 25. We need more money for the foundation. This year, we have a target of 410 million. We have to do that. How will we do that without your support? And we have, other than that, a target of $50 million for the Polio Plus Challenge Fund. If we are not able to do 50 million, we would not be able to get 100 million from Bill Melinda Gates Foundation. When you donate to Polio Foundation Fund, your $1 becomes $6, and we have to support it. Rotary Foundation is our foundation. Rotary Foundation is a two-way stream. You give and you take. So, my friends, please support the Rotary Foundation. Please continue donating, and please continue using the global grants. Global grants is undergoing more changes to make it more friendly, and whatever issues, whatever problems you have, our committee is there to solve it. The global grant management also is very friendly, and thank you for listening to me.
thank you, Aziz, Trustee Aziz,
Se-
for
se-
your
se-
valuable suggestion.
Can I draw attention of Trustee Aziz? Salim, can I give me
Yeah,
1 minute, please?
Our
Can you?
time is very limited. Okay, go ahead.
1
Yes.
minute, 1 minute. Trustee Aziz, I mentioned about, say, last year in 2019 and 20, there were 1,359 grants where the World Fund contribution was only 43 million. And the total expenditure was 105 million. So this only 45 millions, last year there was equal match for the 50% match for the cash. So why Rotary Foundation cannot borrow money from the endowment fund? Because we have a plan to make it to 2.025 in 25. But in the dull period, in the crisis period, is always like that. Our government is taking enormous sum of money from the bank, from their reserve, to come out of the situation. The plan of 2.025 in the year 25 will be materialized. It may be delayed, but the present crisis can be overcome. That's why my suggestion was. Thank you.
Okay,
Thank you. Thank you, Zeni. Thank you, Zeni. We have within the Rotary Foundation Trustees Committee, we have investment committee which is looking into this. And what your thoughts are, we have similar thoughts. We are looking into all areas where the funds are available, and in this coming meeting, we would be able to take some good decisions. And I would be too glad to pass on your suggestions if you put it on an email and share it with me. Thank you.
Thank you, Aziz.
I will do that.
But the question
Salim?
was from, the question was from PDG Tayyub was different. He was talking about the public image that what we are doing right now. What is the impact of the public image that we are creating after in this COVID situation? Tayyab, for your information, let me share that you know that District 3281 is doing fantastic job in this COVID situation. And the mayor of 3 cities, they came forward to work with the Rotary. They even offered 3 hospitals in 3 different cities to hand over to the Rotarians to work with those. So you can understand from these only that the public image, the work that Rotary have done in this COVID situation, the public image has gone really up, you know. So I think it is like Bangladesh, it is also happening in Pakistan, Indonesia, Singapore, and all over the parts of the world, you know. So we will not take any more questions because we are already coming up at the end of the session.
Hang on.
Now I would like to, Justin, you want to say something?
Yes. Can I share?
Yes. Yeah.
Okay. Thank you very much, all the speakers. What I want to share is number one, it makes Rotary foundations a very difficult decisions to make to stop the matching of the cash. Now, while we suggest to Rotary Foundation, that is not the end of the world. Let's look back to our 4 priorities: increase our impact, expand our reach, enhance participant engagement, and increase our ability to adapt. In these tough situations of COVID, what we have to do is we have to reach out to our community. To our community, meaning to say is that enterprise company, convince them to contribute to our projects. This is the best way. Now look at our own districts. How many Rotarians are not contributing to the Rotary Foundation? This is very important. We have to work together as district leaders, as club leaders. Please convince your Rotarians to reach out to the community, to reach out to our own Rotarians. This is more important. Instead of waiting for the money to come, we have to do something. We need to create an impact. Those were the days whereby we quietly do the projects and do not share to the multimedias or what. So for Tavi question is very good because many of us, I just did a seminar this morning. Many times we do projects, after that we keep quiet. Now today, in order to let more people know about it, we have to tell people what we are doing in Facebook, even in TVs. Reach out to the outside world. So thank you very much because I like what Shahu has shared. Rethink, redesign, and recalibrate. Yeah. This is what we have to do. This is what we have to do because we have to change. Today we are on 5G. If we keep on thinking of the old things, nothing will happen. My fellow Rotarians, it is us who make it work. All right? Rotary Foundation, Rotary International only provide us with the infrastructure. It is Rotarians that make it work. Let's work together and reach out to serve our community. Thank you very much, Salim.
Thank you, Jason. Before we go to our director, Surgeon, I'd like to make one comment that from all the speakers, all the experts, what we learned. We learned that we must support our Rotary Foundation. Friends, this is our foundation. If we don't support them, how they will work? So I will come to the Leslie after the surgeon's remark. He will be the last one. So we have to support our foundation. Let us bring all the Rotarians. There are so many people in Rotarians that they don't contribute a single money to the Rotary Foundation. So let us convince them, let us inspire them to contribute to the Rotary Foundation. Okay, now can I ask, Leslie, you will go to first?
Sure.
Before Surgeon? Okay.
Thank you, moderator. Trustee Aziz, regional and district leaders, and my Rotary friends, very good evening to you. My task is basically, as mentioned in the program, to review and reflect the three presenters or three panelists in our first session of the Regional Rotary Foundation seminar. And as the repertoire, I'd like to kick off with past Governor Zainal Abidin's session. His topic was grants and challenges during post-COVID period. And he actually started off with the impact of how COVID-19 has affected the global economy. He quoted from the CNN correspondent, Dr. Chandia, and he has mentioned that it is not only just an economic, social, and human crisis, rather it is not just a health crisis, but more of an economic, social, and human crisis. And it's impacted so many lives. It has changed the whole worldview of how we do things. It is in fact, he has reckoned that this is even worse than the tsunami, the 2008-9 global financial crisis, and nearing the impact of the depression, the whole impact of this. And this has impacted both employees in the traditional sectors as well as those in the gig economy. Now here's, but how long will it last? And will there be a second and third wave? And what does it present? And what are the challenges then in terms of, for us as Rotarians? And he has actually mentioned that, in fact, the vision of creating a lasting change for a better world is now, we are shaken to the core. It has impacted us tremendously in terms of the grants. Rotary Foundation has given lots of grants, and Rotarians throughout the world has supported their beneficiaries and frontliners in terms of distribution of personal protective equipment, hand sanitizers, food distribution, as well as even global grant. There was a relaxation in rule of the global grant in terms of the international matching, but he made a passionate plea regarding the continuing with the match of the World Fund where possible in terms of cash, where possible. He spoke about Bangladesh been following the prescription of the World Bank in terms of how the immediate cessation of support in terms of screening and in terms of going down to the grassroots level, very much in terms of what World Bank has recommended. And in terms of the education sector, there's so many children out of school. This has certainly impacted grants, which are on the education, touches on education. And because of virtual learning, he's spoken about connectivity. How can we improve connectivity in terms of grants? And he wrapped it up by giving an idea of both the districts in Bangladesh in terms of the projects which are COVID related, coming up to about 516,000 USD. So basically, the wrap up, that was a wrap up from past Governor Zainal on his session. And then we had past Governor Anthony Richards, who spoke about best practices grants in a post-COVID era. And he added his personal touch in terms of putting a question mark at the end of the topic. And he said, he started off, and I always use this in my presentation as well. So thank you, Richard, for that. So he started with this line, the dinty on good, better, best, never let it rest till the good is better and you're better best. And in terms of fine tuning of grants, in terms of best practices, the methodology that we can use, what are the, how can we improve our grants to 100% where possible, a success rate. And he has gone through a very detailed sharing with us in terms of his slides on the best practices that we can apply as the Rotarians wanting to go into global grants in terms of how we look into the application, how we look into the project implementation, the project reporting, monitoring, and evaluation, as well as the final reports. And he also spoke about realigning One World, how the way we do things in terms of how COVID has impacted, in terms of increase in collaboration, in terms of how we can use more virtual tools for better connection. So how can Rotary leverage on a global presence in terms of selection of people and countries for fair distribution of vaccines using our experience and expertise in polio eradication? Can we do that for the COVID-19 vaccine once it becomes available? And he went on in terms of virtual setting versus the in-house or in-person setting, that now the whole grant management seminar scenario is totally different. Everybody has a VIP seat. Everybody has a good view and can hear the speakers. So it's totally different from our experience of attending an in-person seminar where we have to travel great distances and we have to pay a seminar fee. So now it's totally different. And he also talked about how to build a team for success. So he shared a few models for a great team. And he went on to talk about engaging the regional grants officers for project eligibility. He spoke about how we can increase increasing the contact. Now with COVID-19, it's so much easier. Everybody is on online, except that sometimes you do get a standard response that because of the increase in workload and because of the working from home, some of the grants officers will take some time to respond, right? And he also shared with us in terms of how you must describe your community assessment. And he also spoke about how you can connect, consolidate the grants processes and resources, and selecting ideally one area of focus was another advice that he proffered. And in terms of the provision of basically a plan, a plan of your budgeted plan, and explaining Rotarians' involvement, as well as providing an itemized budget, and also in terms of
Leslie, you are
explanation
over 2 minutes.
Of the project. And he wrapped it up essentially with the whole idea of providing consolidated and detailed needs assessment. And finally, we had past President Dr. Shahul, who spoke on recommendations and takeaway messages. And here, Dr. Shahul shared with us a number of slides of some of the projects that have been impacted in his personal experience over in Nigeria, over in Indonesia, in Malang, and also in Singapore. And he's basically the projects that involves school children, with the schools being closed, and in terms of involvement of students who are supposed to play games in the field, and in Singapore that they can't have public gathering and in playing field games. So that has also impacted. And basically mental health wellness projects as well. That's also basically a side effect or an effect of COVID-19 pandemic. And these have also resulted in mental health issues. So he has come up with his mantra of rethink, redesign, and relaunch projects in his own words. And he would like all of us to also perhaps rethink, and perhaps the TRF officers and the trustees to maybe look at this again in terms of how COVID-19 has impacted us tremendously. So with that, with his sharing, basically it was all about, he has identified so many projects that is impacted in so many ways.
Thank you,
because
Leslie.
of COVID-19. So thank you very much, Chairman. That's basically a summary of the three speakers. Thank you so much.
Thank you for your summarization. And let me again thanks all the three speakers. They spoke very well. Now we come to the fag end of our session. Can I now request our Director Surgeon to give his closing remark?
Okay, moderator, EMGA Salune Racer, and all the panelists, my fellow Rotarians. It is a great pleasure of the Rotarian to have a virtual online Regional Rotary Foundation breakout section. This is the first time we can ever have for the virtual meeting due to the COVID-19 pandemic. I hope we will enjoy it and receive the great message. Thanks to the organizing committee of Regional Rotary Foundation. They have made the good design of the program for us and give us the best message. The Rotary Foundation has received the contribution from Rotarians over the world. We need to continue our past efforts and to donate money to the Rotary Foundation. The foundation has good management of the money, and we have ranked high in the administration of the world. We are proud to have good service program in the world. The project have been successful and in time to make the service. Let us work for the good in the world and make great contribution to the foundation. Today we have speakers talking about grant and challenge and the best practice of grant during post-COVID-19 period, and recommendations and take away message by all the panelists. Last, I hope everyone enjoy tonight's breakout sessions. Thank you. Wish all of you healthy and safe. Good evening and good night. Thank you.
Gimbok, you want to say in one word? Chairman Gimbok.
Moderator in one word is not possible, but having listened to so many distinguished panelists, I just have to thank a few people. I mean, my job as a chair has been made a lot easier with the help of many people. I mean, like Convener Surgeon Liu, who has given me this opportunity, and tonight, okay, I think Trustee Frederick Lin has already left us. Okay, just giving us the message, and of course, all the moderators you have discussed, and all the topics have been well presented and discussed. So you at this extraordinary times, we call for extraordinary action. So I think we would like to quote what PP Sao has said. I think it's an opportunity for us to rethink, redesign, and relaunch. So whether it's a COVID or not, life must go on. So, okay, so let me take the opportunity to wish everybody good health, stay safe.
Yep, thank you. Thank you, Gimbok. We are just at the end of our session. Let me thanks again Past District Governor Zainul, Past District Governor Richard Anthony Richards, Past President Sahul, Past District Governor Leslie, and our trustee Frederick Lin and Aziz, Director Surgeon, Chairman Gimbok, and finally Jason, District Governor Jason, RRFC, and finally the person who helped us to have this everything arrangement, our specialist Hazel. Thank you very much, Hazel, for your cooperation. Now we come to the end with one word, that this is our foundation. You know that what foundation have done immediately when the world is in this world pandemic situation. They come up with all the disaster management fund and all this situation they tackled, and they need our help to build up the World Fund again. So let us come up with the way that how can we help Rotary Foundation to build up the World Fund again and to help the world community in a bigger way. Thank you very much, all the people. I have been in last 25 years attending the institutes, but I feel this one is the best. Almost 150, more than 150 people attended today's breakout session. I have not seen so much people in one breakout session in physically. So I think